Hi, my name is Art Bergeron, and if you haven't seen this show before, I am an elder law attorney. That's my day job. I work at a large firm called Myrick O'Connell and come to the island every other week. But this is not about my day job. This is about my friends Frank and Mary. If you've seen the seminars that I do with the Salt Marsh, or the seminars that are actually now on NCTV that I am pre-taping. They always talk about Frank and Mary and their kids, Peter, Paul, and Mary Jr. And Frank and Mary's goal in life is to live in their house until they die and be buried in the backyard. And if that's your goal, then, and you maybe can sympathize with where these folks are, that's the reason for this show. So I have a wonderful co-host, Allison Forskren, whom everybody on the island seems to know, who has been here forever, and whom I met actually because we were on the board together at the Friends of Our Island Home, and she's been obviously in the Council on Aging and done a bunch of things, but mainly she has been great about finding the people that you may want to know if you're Frank and Mary. Although we have had this particular guest on last year talking about a topic that you're all thinking about right now, or should be, and that is re-enrolling for Medicare. So, Allison, who have we got?
Well, today we have our very popular Peter Mackay. He is a consultant of everything, basically, having to do with healthcare, Medicare, Medicaid, disability, etc. Anything else, Peter?
Social Security, and scratch the Medicaid. The Medicaid, I would still recommend going to my old department at the hospital, the social work department. They'll be the ones, the healthcare advocates, that assist you in that endeavor. But everything over 65, Medicare, Social Security, disability, home healthcare, those types of things, designed to keep Frank and Mary home.
Designed to keep Frank and Mary home, and out of the poorhouse, specifically out of the nursing home, but also out of the poorhouse.
Right.
Well, you've come to the right place to talk to people over 65. So I can remember the last show we did with you was fascinating. For someone who has no idea what they're going to be in for in a few years. But please, how do you want to start? It's open enrollment.
Well, the primary time right now, yes, exactly right, Allison. We're in the open enrollment period. It runs from October 15th through December 7th. And this, for most of our senior friends out there in Nantucket, know that this is the time that I've always recommended to look at your Medicare Part D prescription plan again and evaluate it. I know it's frustrating to require to look at it every year, but by doing so, you make sure you have the best coverage every year, because unfortunately, as I've said so many times, these for-profit boardrooms know they're going to change those plans on you every year and try and make a profit out of you. So you got to be smarter than them and stay ahead and look at your plan during this month and 3/4 period of time.
Related to that, relate the story that you just told me about the person that you spoke to recently, right?
Yeah.
Who didn't see you last year but came back this year.
I just finished just before this broadcast with somebody, one of my appointments today, and he came in and he said, "Oh, I screwed up. I didn't meet with you last open enrollment period. And I had to pay so much more for my medications this year of 2020, because by not looking last year, he was forced to keep the same plan. So this year he said, I'm meeting with you, making sure I meet with you because I want to make sure I have a better plan. And he spent well over $1,000 more this year in medication costs that he wouldn't have had to have spent if he stayed ahead of it and looked at his plan last open enrollment period.
And in that case, the plan, he didn't change plans, right? The plan itself changed on him.
The were actually exactly the same, and the coverage he had was the same plan, but the plan changed. It changed its premium and it changed its formulary coverage.
So he lost $1,000 by doing nothing.
And what I didn't tell you is last week, a good friend of mine who does take a higher priced medication, he also missed last year. His difference this year was $8,000 difference.
Wow.
So
and that's out of pocket.
That's out of pocket. He spent this year, 2020, because he didn't, and he takes a cancer medication, but he spent $8,000 more for his medication costs this year than he did next year. In fact, as he was leaving my house, he said, Peter, I love you. It was very endearing, a little awkward, but anyway, always happy to, help the seniors here in Nantucket and anywhere else, because I actually do a lot of long distance. I have phone calls. I've done 5 people from Florida, a couple people on the Cape. So you don't have to reside in Nantucket to take advantage of myself or somebody like myself elsewhere to be able to assist you in choosing a plan this time.
Yeah, Allison, actually, one of the things that I had mentioned to Peter was that as a result of the fact that everybody's on Zoom now, I've actually been able to suggest that people back here in the United States actually call him, right? Because he can do it. He can kind of talk to them and it's just extremely useful.
Yep. All you need to do is plug in the zip code, and I can pull up all the plans for that area and let you know which one's the best based on your meds.
Wow. And so, if you don't mind me asking, what does a consultation like that cost?
My consultation for this period of time is $75.
Wow.
Yeah, exactly. It's like what? It's like nothing, right? So, can you just kind of take us through? Because I recently, Allison, the Zoom seminar. I do Zoom seminars, monthly. That NCTV kindly puts up on the website. And for this month, it's a Medicare one. But in order to prepare for it, I went and talked to Peter. And I said, so Peter, so how do people figure out specifically this piece, the Part D piece? Can you just kind of go through that? How people would just go about figuring it out?
How people would go about it isn't anything particularly fancy. It's a question of just utilizing the Medicare website, which is medicare.gov, and utilizing it effectively. And to be honest, people can actually do this by themselves there too, if they feel comfortable. It's going to medicare.gov, and now they have look at your 2021 plan. So you can click that. You click through a couple of other easy questions about looking at just your drug plan. I don't get extra help. And you get to a point where you can enter your medications. So what I do for everybody is, okay, give me your first medication, atorvastatin, simvastatin, whatever the medication may be. I type it in, making sure I get the milligrams and the frequency in, so that it is quite accurate. And then I pick the pharmacy, and because when I put in the zip code on Nantucket, it'll pull up Nantucket Pharmacy, Island Pharmacy, Dan's Pharmacy. When I went to a zip code in Florida, it has your Walgreens, your Walmarts, your CVS's, and everything else. We pick the pharmacy. So those are the prices for that particular pharmacy. And then the next button clicks, it will screen all 27 plans from which one covers you the best to which one covers you the worst. And the difference, as I've said before, is often thousands of dollars for the same coverage, same meds. Nothing else is different. It's just the contracts with the pharmaceutical companies. So it doesn't take more than about 20 minutes per person, but it's probably one of the most valuable 20 minutes that most of the seniors are going to take.
Well, so I've got a question about, if there are going to be 27 different plans, how do you know if you might want to pay a little bit more for, right there, that would get me 27 choices.
Well, in 2006, there were 54.
Wow.
So, yeah, I know. And so as I jokingly said, I probably said this last year, but in the fall of 2005, I was trying to figure how in blazes am I going to make sense? Because I knew I was going to get inundated with questions about, well, how do you pick? Just like you said. And there's no allegiances to name. You'll find a lot of plans out there that have names that you wouldn't recognize, like Silver Script, Clear Spring, Elixir, Mutual of Omaha is a plan. So they're all reviewed by Medicare to make sure that they meet the basic qualifications. It's not a fly-by-night. They're obligated to provide the coverages that are on the screen. And as I say, my allegiance is to whoever serves me best that particular year. And that's it. If by chance they also provide the best coverage for me the following year, fine. But rare is it at the time. Because my understanding of the last 14 years of this is that these boardrooms, these for-profit boardrooms, know that 90% of our country's seniors do not bother taking advantage of this open enrollment period. And they just glide into next year. And these boardrooms pull the oldest trick in the book, the bait and switch. They'll have a good one, get a lot of people to enroll, they forget about it. And the next year, they switch. They change the premium, they change the formulary, and they make their profits off your back. So being who I am, and Arthur, you know this in particular, I'm not a big fan of big business, and I like fighting for the little guy, and nothing upsets me more than our seniors being taken advantage of. And that's what's going on right now.
It's illegal to me. I just can't imagine that on a website.
Yep. Here's the CYA stuff for you. They will send you, everybody who has a plan, they'll send you prior to this open enrollment period, a thick book of all of their formulary and everything else, as if you're going to read through that formulary book and determine that your meds that you covered this year are going to be different. So legally, they say, well, we informed you. And from that perspective, they have their you-know-what covered. But practically, it's highly impractical that most seniors are going to take the time to read through it and or understand. And the pharmacies change, too. I mean, some pharmacies, down in Florida, I put in the person's normal pharmacy, Walgreens, and it wasn't even a standard. It was not out of network. So I said, you got another pharmacy in your area? Well, there's a Walmart across the street. I put that in, it was perfectly covered across the street. So it makes a difference, not just the plan, because they have contracts with the pharmaceutical companies, but it also makes a difference which pharmacy you choose. So the detail there just gets a little bit more than just going on the line on site and doing it. I encourage people to try, absolutely, but I'm here for you in case you're having frustrations and or can't do it.
So I've got a question about what if you need a new prescription and you just have to stick with the same plan, the same pharmacy, even if you can get it cheaper somewhere else?
That's a great question. So especially if you're looking for next year and you're thinking things really did change, so I'm sicker or whatever, so I'm going to be needing some new stuff.
Yeah, unfortunately that is one of the big loopholes. When I was looking through the plan, seeing what a crazy kind of plan they came up with in 2006, that's one of the big loopholes. You're locked into that plan. However, there are some constants. As I said, Medicare reviews any participating insurance company to make sure that they meet the 3 criteria, which are basically 1, all tier 1 generic meds have to be covered. And that includes a lot of meds. Okay, that's good. So all 27 will cover them. 2, all antibiotics are going to be covered. Okay, that's also a big one for anybody that takes a Z-Pak or azithromycin. We all get infections periodically. And 3, all steroids are covered. So if your new medication falls into one of those classifications, no worries, you're covered. However, your point well taken. If you take another med that's not a tier 1, not an antibiotic, not a steroid, yeah, it may not be covered.
Wow.
Yep.
One of the things to always keep in mind, it may be bad this year, but there's always next year. One of the nice parts about being in this system is that if you're in trouble this year, or if your health changed this year as a result of which, you unfortunately unanticipated, you're paying more in drugs than last year, at least that starting next year, you can reset, right? You can go back and look for a plan that's actually going to fit what you need.
And actually, given all the years I worked at the hospital, Allison, follow up to that other point about a new medication is that I will also counsel people that they can go back to their physician and say, is there an alternative? Remember, physicians prescribe meds based on what's the best care for their patient. They don't necessarily screen for the cost. So if you bring that information that this new med you prescribed for me is not covered under my plan, there may very well be a very satisfactory alternative. That's one thing. 2, I also can guide people to go straight to the pharmaceutical company that makes the medication to see whether or not that person's eligible for their patient assistance programs. So those are the only other pieces of ammunition I've got in my arsenal to guide people through that big loophole in the Medicare plan setup.
Yikes.
But that's a big deal.
That's a big deal. Yeah.
It's a big deal. Because that was, Allison, that was something else when I was talking to Peter to kind of get ready for the seminar. And I realized that there was always a question of, well, are you going to get the brand name or are you going to get the generic? But it never occurred to me that from the doctor's perspective, there may be a brand name X and that will deal with this condition, but there may be some other things that will also deal with that condition that are brand names that may end up being much less expensive, right? But that's something that you need to be, aware enough to be able to talk to your doctor about. So it really means really having your doctor as part of this conversation, right?
Correct. Absolutely. Unfortunately, they still have the donut hole, that cockamamie thing where if you spend so much in medications, you then fall into the donut hole and you have to pay more. However, it's been mitigated since 2006. Now you only pay more for brand name drugs. Generic meds in the donut hole actually get a little bit cheaper. So
what is the donut hole again? That must have slipped my mind from last year.
They technically call it the coverage gap, but almost every senior in the country knows it as the donut hole.
The donut hole.
And that is when you spend X number of dollars. I believe this year it's about 3,100 thereabouts. Don't quote me on the exact number. Then you hit the coverage gap, the donut hole, and your coverage changes. Your generic meds, which are already cheap anyway, go down, but your brand name ones, you pay more. And you pay more until you hit the other end of the donut hole, which is generally around 5,100. If you actually spend that much, then you hit the catastrophic coverage, and your coverage kicks back in again better than before. And as I said in my letter to Mr. Levitt back in 2006, who was the Director of Human Services, I said, why would you come up with such a crazy plan? And I got a letter back from one of his lackeys saying, we didn't have enough time.
But it's never changed.
It's been mitigated a bit, because it used to be you pay full cost of the med in the donut hole. Now it's, as I said, it's been softened a bit, but the concept's still the same.
But Allison, the interesting, this is something else that Peter taught me. The interesting thing about the threshold at which you hit this donut hole where you end up paying more is that's measured. There was a figure that Peter gave, it was $3,000 some odd dollars, but that's measured not by what you paid when you went to the pharmacy, but what the actual cost of the medicine was. So you may be going to the pharmacy every week or every month, and you're paying $50 here and $20 there and blah, blah, blah. Maybe you've paid $400 or $500. All of a sudden, you're in the donut hole because the total cost of those drugs, not just the total cost was like $3,000 some odd dollars. So all of a sudden, you show up at the pharmacy like in June or July, and instead of a $20 copay, you're like at a $200 copay, and you had no idea.
And guess what gets counted against the other side of the donut hole? Just what you pay, not the full cost. So it extends that donut hole even broader.
This is why I don't like insurance. It just makes no sense to me at all. And
if you allow the for-profit companies to be able to run the show, that's what's going to happen.
When I asked people, Peter, I said, so how do you solve this? He said, it's simple, single payer. Yep. So this never was going to work as long as you've got 27 companies, each trying to figure out a way to keep you doing a bait and switch.
Yep.
And so that's the solution is one what do you call that again? One payer?
One payer system. That would eliminate, it would eliminate jobs, but in my opinion, eliminate a lot of unnecessary jobs. And more importantly, it would provide far better coverage for far less money, as far as that's concerned. And to me, it's a non-debatable thing unless you're just trying to protect your business or your company or something else. If your focus is truly the residents of America, the seniors, then it's a no-brainer. You can't really argue it. But politics being what they are, we all know there's arguments everywhere.
Right. It's like when I'm dealing with clients who are saying, so isn't there a point at which, the government's just going to start, covering like nursing home coverage? And I was like, no, I mean, that's the right thing to do, but never. It's just, because of the system, you just have to accept that. Right. I had a senator
3 years ago, I had a senator and a representative in my office, and they wanted to know about the plans. And I pulled up a test example and showed these guys exactly what, disparity. And they look, you're kidding me. Look at that. And I said, yeah, these are the guys that voted this in, helped to participate in it, and they didn't know. But to be honest with you, it was interesting. That was when one of them said, well, what we're working on is now become much more familiar to all of us. They were talking about Medicare for all, which, as we've all heard in this last election run here, that's now become a more popular mantra. But that was their answer at the time when they did not know about the discrepancy of the drug plan.
So, Peter, can you talk something a little bit about, and this is something else that I had about no knowledge of until I spoke to you about Prescription Advantage?
Prescription Advantage, yeah, it's an available program in Massachusetts, and it's very, very good for those people who take a fair amount of meds and spend meds, because what it does basically, and the eligibility guidelines are very liberal. I believe it's about 500% of the federal poverty guidelines. So that makes a lot of people eligible for it, especially on the senior side. And if you apply for Prescription Advantage and get approved, they will eliminate your excess costs in the donut hole. So when you hit that 3,000 and change figure and your brand name drugs go up, you won't pay more. Prescription Advantage takes care of that difference. You will continue to pay what you would be paying during the regular coverage period. So it's a nice advantage that Massachusetts has. Whether or not other states have similar types of programs, I am unfamiliar. I'd be doubtful, but for residents of Massachusetts, it's a good thing for those people that take a fair amount of meds and do hit that donut hole.
Right.
And so where would you learn about that? Is that up on the
Where
web?
did I learn about it? To be honest with you, I can't really say. I kept my ears open all those years in the hospital for anything related to how to improve. And somewhere along the line, somebody gave me that information probably 10 years ago.
Jeez.
And I know they have a website, because actually the lady, there's a woman who does outreach of Prescription Advantage for the Commonwealth, and she actually appeared on my show in Framingham like last month, right? And it was really fascinating. And so I guess what I would urge people to do is, if you Google that term, you'll go right to the mass.gov website that'll get you into Prescription Advantage. And this is one of those classic cases. Don't say no to yourself. If you are a senior, chances are Prescription Advantage is going to save you money. Chances are way over 50-50. And you're going to qualify. I have the income amounts above which you don't qualify are like huge. They're like for a single senior, they're like $65,000 or something, and for a couple, it's like 80. They're very, very high.
They're very liberal. A lot of people would be eligible. Yes.
Don't say, and if you have lower income, then the plan is even more beneficial for you, right? So you really want to check it out.
Even if you don't see me or another consultant or anybody else to help you, doing Prescription Advantage is a no-brainer. Do that anyway, because even if you stay with the same plan, it'll help you with that donut hole, and it'll save you potentially quite a bit of money. So that's a no-brainer.
And so that's not something that you have to reapply to every year.
No, actually, you do have to reapply every year, but you can do it. You're not limited to the open enrollment period. You can do it at whenever.
Right. That's a real advantage. Now, I know that in many communities, Peter, there are shine counselors who handle this from the senior, like volunteers who get trained who try to help out. But I think did you mention to me there's been an issue with that specifically in Nantucket? Right?
Yeah, I found a question about that, and we have had somebody for the past few years, and their volunteer work is very appreciated. But they won't have one this year. And the answer I got is primarily because of COVID. So in this situation, that option is not there. I will say that my old department at the hospital and the person that replaced me, Sarah Munson, is also doing this. And she and however many people of the staff are still going to continue to try and do it. So that's another option for people as well, certainly. And I encourage people to be able to look for her as well.
So Allison, that's it. Aren't you just dying to become a senior so that you can learn all this stuff? It's just
no.
I get to say that next year I get to enroll, and I got to say I'm looking forward to it.
If I were you, I'd probably be looking forward to it. But and so do you do the starter program? If someone is just getting ready to age in, can they work with you as well?
Yep, I'll help you get enrolled in Medicare and understand the whole supplemental process, the prescription drug process, and also the other thing which we didn't talk about was Medicare Part C. Remember, there's actually 4 parts of Medicare: A, B, traditional Medicare; C, which people don't talk about too much, is known as Medicare Advantage, and now the famous Medicare Part D, D for drugs, if you will. Medicare Part C is a Medicare Advantage program where a private insurance company takes your Medicare benefits and in return gives you a package of benefits, which is enticing in many respects. There's pros and cons. It's got prescription coverage included. It's got some vision and dental coverage. Nice. You still have copays, but the big thing for Nantucket is you're limited to a catchment area of providers. And guess who is not included in any of the Medicare Advantage plans that I know of? Any provider on Nantucket.
Right. That's right. Or Martha's Vineyard, actually.
Or Martha's Vineyard too, probably. Yeah.
Neither place. So that's why when I did the seminar, I actually did. At the end, I talked about Medicare C and said, except in Martha's Vineyard and Nantucket, these are a great. You have to kind of figure them out, right? So Peter, thank you so much for this. This is. It's a great refresher, and I think, what I keep trying to tell people is, do not. I had a slide in one of my seminar things that just said, "You will never figure this out on your own," right? And so, one of my paralegals said, "You can't say that. That's insulting to people." So in the seminar, when I was actually talking it, I said, "Let me amend this. I would never be able to figure this out on my own," right? And maybe you can, but I can almost guarantee you that you will save money by having somebody actually work with you on this to figure it out.
I have to tell you this then, Arthur and Allison, because it just makes me smile to tell it, but along the lines of what you just said, how difficult. It was 4 years ago, I had this very nice gentleman in my office, and he was reviewing the plans, and he was very complimentary, very nice, well-spoken. And he said, boy, this is really complicated. And I was sort of self-effacing, going, well, it's just repetition, it's just, I don't want to make a big deal. But he said it a couple of times, and he had this disproportionate smile on his face. Eventually, I had to ask, I said, you seem to be smiling a little bit disproportionately for this consultation. And he said, oh, I am. I said, can I ask you why? He said, sure, I just got to tell you what I do. So what do you do? He said, I'm a rocket scientist. So for all those people out there who feel it's too complicated, you're in good stead.
You're in good stead. That's right. But at least so you can no longer say, well, it's not rocket science. What you have to say is it's not Medicare Part D.
That's right.
Right?
That's a really good story.
It really, I just laughed when I heard that. So anyway.
Peter, thank you very much. This was really helpful.
Peter.
My pleasure, Arthur, Allison. Good to see you both.
Allison, it's always great to see you, right? Because I don't get to see you live very much anymore.
I know.
But so and for folks, I hope you continue to enjoy these shows. If you've got any suggestions for Allison and I for particular people or topics that you'd like to have us cover, please let us know. And we'll look forward to seeing you on the next installment of Frank and Mary here on Nantucket. Thank you very much.